I am going to pass it over to Pippa Rowcliffe to speak and share her work by the HELP project. Pippa, it's all yours.
Thanks so much, Diane. Can everyone hear me okay? Am I loud and clear?
I think you're good.
Okay, great. So first of all, just wanted to acknowledge the work of the PAS team, Marni and Mariette particularly. It's such foundational work, and it's work that we draw from a great deal in what we do. So I'm going to talk a little bit about what we do at the Human Early Learning Partnership, University of British Columbia, and there's lots of parallels and consistencies. The story that I'll unfold, I hope you can see as synergistic to what you've already heard from Mariette and from Marni. So the Human Early Learning Partnership is an interdisciplinary research unit. Our vision is healthy, all children thriving in healthy societies, and we've come to believe that that's what connects us with all the other people who do work alongside us. So that's other researchers, but it's also government, community people, organizations and institutions across the province. And there's two broad themes that we emphasize in our work. The first is really good interdisciplinary research, and the second, which is the theme I'm going to unfold more here today, which is mobilizing knowledge. How do we take the data and research that we gather and put it into the hands of people who can use it to influence the lives of children directly? So I do want to acknowledge Clyde Hertzman before I go any further, and actually Marni and Mariette referred to a couple of seminal reports that he produced, and he was the founder of HELP. He passed away 5 years ago now, way too early. But I want to highlight some of the things that he exemplifies for us at the Human Early Learning Partnership, and I think it flows through the presentation that I'm going to give as well. His courage, compassion, and commitment to this work, into equity, into having children have the best and optimal outcomes possible. The idea of no data, no problem, no action, the importance of this kind of research. The importance, and I think Marni and Mariette highlighted this, of society to cell models, so thinking about children in a much broader context of embedded environments, focusing on the differences that make a difference, so some of the programmatic and intervention work that you just heard about would fall there. And then this powerful idea of equity from the start. And with that theme in mind, I do want to acknowledge that the Human Early Learning Partnership is built and operates on the traditional ancestral unceded territory of the Musqueam people. We're grateful to live, play, and work there. And one of the things that HELP has pioneered over 15 years is a very close working relationship with friends, colleagues, incredible mentors in the form of an Aboriginal steering committee who come together twice a year and guide pretty well everything that we do. And from an equity perspective, the role that they play at HELP is foundational, fundamental, and has actually changed the culture of our organization. So I just want to honor these amazing people who actually were gathering for the last 2 days at the Human Early Learning Partnership. So I'm going to talk about a monitoring system that HELP is building that we call HELP's Child Monitoring System. It was built off a report that was created by a national group of advisors called the World's Best Infrastructure of Child Development Statistics. And what we've been building is an intentional and focused monitoring system that helps us track children from birth all the way to school leaving. And I'm going to talk about the components of what you see in this diagram. There's lots of acronyms here, and I will describe TDI, check, EDI, MDI, MDI, YDI as we go through the presentation. I'm going to particularly focus on check EDI, but I'll mention the others as well. I also want to acknowledge the powerful importance of linked data sets. HELP is actually doing some of the same work that Marni and Mariette highlighted, the idea that if we can build these population-level data sets and link them to existing administrative data sets, we have an incredible power to understand a range of things, both interventions, but also how our children are doing across time in very real ways. Okay, so I want to just highlight quickly one important part of what HELP does, and that is the distinction between what we call population-level monitoring and individual assessment. So the idea of individual child assessment is that We look at an individual child, we assess them, we produce a report on them. It's used by practitioners, teachers, and parents towards a personal treatment plan, and then we monitor that plan so that we understand how every child is doing. The work that helped us falls more into this idea of population-level monitoring, so the idea that if we can look at how groups of children are doing in terms of their outcomes, we can really understand how to plan interventions, whether that's high-level policy or specific programmatic interventions around these groups of children and how they're doing. So the idea of population-level monitoring is we assess groups of children, we gather individual-level data, but we look at them as groups, whether that's classrooms or neighborhoods or at a regional level. We use it with communities, government, school districts, health authorities, non-governmental organizations, and a range of others to help support planning and program development. We generate strategies, policies, and a range of other things with these data and reports, and we monitor and evaluate impact over time, and I'll unfold that theme a little bit as we go here as well. So some of the, one of the things I really want to highlight before I get going on the monitoring system itself and some of our tools is that underneath this are some really foundational concepts that for me are almost more important than the data themselves at times. And some of them are, you'll hear echoes of what Marni and Mariette have already talked about, so children embedded in their neighborhoods. I'll talk a bit about proportionate universality. Context matters and matters greatly. A little bit about biological embedding and sensitivity and risk and resilience. So I just want to unfold these briefly because they're so, so important. So one of the most important things about data and using data to support effective planning and program decision making is the importance of actually working with data of the children for whom the people you're working with. So working with a particular district, that you can actually give them a snapshot and really important information about their children. So what you can see here is that we at HELP report on provincial data, this school district data, we report on neighborhood level data, we can go all the way down to census level. And this is powerfully important because it really actually catalyzes people to pay attention when they're looking at their own children. The second concept that's powerfully important for us is one that's called proportionate universality. So the idea here is if you look at this map of this is actually Greater Vancouver, Vancouver. The map in the background is one of childhood vulnerability. So the map shows areas of dark green, yellow, and dark orange and light orange. The darker the orange, the more vulnerable that neighborhood is, and I'll talk a little bit about the data that we use to do that. And then the green areas are places where there's less vulnerability. Overlaid on top of that, every one of these little orange stick figures is 5 children. And so you can actually get a sense there of how varied the number of children and families across Vancouver are. There's a far greater preponderance of children and families on the east side of Vancouver, and you also pick up that it's actually a more vulnerable area of the province, of the city. And one of the questions that has always come up is how do we use these data to actually target intervention? One of the things that we know is that if we target interventions only using data that actually looks at vulnerability, so pulling out those dark orange neighborhoods that are the most vulnerable, what you can see is that actually addresses high levels of risk and vulnerability, but it actually misses most of the children who are in Vancouver, which are in neighborhoods that have vulnerability, but not the same high levels of vulnerability that we see in those dense areas that we've chosen to invest in. So this for us has been an important concept to work with our districts and our municipalities around that geographical targeting using sort of about vulnerability as a foundation is often not the most powerful way to go because it does not address the fact that a vulnerability sits in all neighborhoods across every region. Another concept, and I'm not going to dwell a lot of time here because Mariette actually highlighted this, and that is that we use also a Bronfenbrenner model for the work that we do. So the idea here, and Mariette and Marni highlighted the Team ECD model, that came out of some early work at HELP. This is an adapted version of it. And the idea here is that as children grow, that graphic in the middle of children growing over time, the proximal environments in which they spend their time, their families, the schools or early child development centers and settings that they spend their time in, the early socialization of peers and cultures has a profoundly important impact on children's health and development. And we call these proximal or close influences. And these are ones that when we think about differences that make a difference, we're most interested in. But the other thing to pay attention to here is the outer circles, which are the containers, if you like, in which these proximal environments sit. So these are the broad policies, and Mariette and Marni highlighted a couple, the broad policies that either do or do not support families to be the best they can be in raising their children. So this would include provincial policy, municipal policy. You can see here also the role that community centers and school systems play, medical institutions. And these create the larger social and economic conditions in which families fit. So this concept is a really important one for us to understand the differences that make a difference. Another one that Marni and Mariette referred to is the idea of biological embedding. So this notion that, and this is something that Clyde Hirschman coined a while ago now, but this idea that actually these experiences and the quality of these experiences, both in the proximal environments and some of those broader environments, actually get under the skin. They are biologically embedded. And we're doing a range of work at HELP around understanding the process by which that actually happens. And that's the science of social epigenetics, being led by Michael Kobor at HELP. Almost the last concept, the one that for me has become increasingly important, is this notion that we can look at all children, but we also have to recognize that every child has a different biological sensitivity to context. So foundational work done by Dr. Tom Boyce, who is the Leadership in Early Child Development Chair at HELP and has actually just published a book on dandelion and orchid children that you'll be able to find out there in the world. That different children have different sensitivities. So we know that there are some dandelion children who tend to thrive in many circumstances, but we also have very highly sensitive orchid children who are deeply sensitive to their context. And these children, the research suggests, do particularly poorly in low nurturant environments, but actually exceptionally well in very nurturant environments. Another concept that we've worked with a lot recently has been both balancing the understanding of risk with promoting resilience. There's a lot of literature out there about the risks and the downsides of poor early experience, and there's a lot known about those risks. Increasingly, a lot of our attention is focused on what are the things that promote resilience. And what we're finding is actually understanding resilience and thinking about those factors that promote it are very motivational, and they actually provide very concrete potential for action in the communities that we work with. So I'm going to talk a little bit about Health Child Development Monitoring System now, and unfold a bit of a story of how we gather these data, what these data show us, and then how we're using them at every level to support policy and program decision making. So the first two are the Toddler Development Instrument. This is a measure at 12 to 24 months. It's an early stage measure of the context in which children are spending those earliest years. So there's a lot of, remember that sort of monitoring assessment versus individual, so population monitoring as opposed to individual assessment. One of the areas that we have least information about in these years is actually the environment in which children are growing from 12 to 24 months. And so the TDI is designed to try and gather information from parents at this early age stage around the environment, what those early proximal environments are like for children. It's an early stage project. It's just in 3 communities right now. I'd like to sort of acknowledge Marni for having been part also of the research team that's working towards building a toddler development instrument. We're very excited about the potential for these data. The Childhood Experiences Questionnaire is a questionnaire that we're developing in British Columbia we will be piloting in 14 school districts across the province as of this fall. It's a parent-completed questionnaire as they bring their children into kindergarten. And again, it's asking parents about the early experiences that children have had before they start school. And the reason we're asking these questions is that it provides malleable information that is actually useful to service providers around what is it that children have been doing before they come into school, what have been their early experiences, in a way that we can support improved early intervention. So again, both tools use this Bronfenbrenner kind of model that we're looking at child health and well-being. We want to understand social experiences, and we also want to understand caregiver well-being and family support and community resources. This slide highlights, and I'm going to put the whole thing up for you so you can see where we're going, the kinds of domains and information that we're gathering on both the CHEC and the TDI. And one of the most important things also here is that we've designed this to align with early development instrument data we have here in the province, and I'll unfold that story next. But what we're trying to understand is what have children's early experiences been around general health, healthcare contact, nutrition, sleep, motor skills, and experiences. What have been their early learning experiences? Have they had experiences with their family or in childcare settings or early years settings around both early literacy and early numeracy, like cooking or sorting objects or counting objects? Have they been to the library regularly? Those sorts of things. The importance also of gathering information about this early social emotional well-being. And we know increasingly the power of social emotional well-being as a foundation for learning and for well-being across the life course. So talking about emotions, sharing, helping, connections with peers, and one important area that we are expanding is this idea of technology. So we have a lot of questions on the CHEC particularly, but also the TDI around children's use of technology, either with a parent or a caregiver or without, and the kinds of technology they're using. We're doing a fair amount of work at the moment with this idea of non-parental and care experiences. I'll highlight that in British Columbia right now, this is a really important area for us to get underneath, given the current provincial 10-year plan to build a universal childcare and early years system here in the province. So these kinds of data are foundational to both planning that and also supporting its evaluation. And then finally, a range of questions around community context. So the importance of these data are that they provide immediate and direct benefit to a range of people at different levels around policy and intervention planning in a way that we hope will help us understand more effectively how we can improve outcomes as children start school as a foundation for learning through the school system. But this is just a more visual way to understand the kinds of experiences that we're trying to understand more effectively. So one of the reasons for doing this work is that we've been working with the Early Development Instrument in British Columbia for 15 years now. We have 7 waves of data, and I'll unfold a little bit of a story about that. One of the questions that we will always get as we're working with our communities and government around the EDI data is, we're watching these data and we're feeling like we're not having much effect. How can we use other forms of data and information to support more effective work in the early years? And so the TDI and CHEC are designed, along with the kind of research that we see coming from Mariette and Marni, to really help people focus attention and investment in those early years. So here in this province, I'll come back to the MDI in a minute. Here in this province, when we look at the EDI, we measure vulnerability, which is children not being ready for school, to learn as they start school. Here in this province, we report on 5 waves of data. So we don't report wave 1, it was benchmark, but we have 5 waves. We're actually just in the fall about to report on wave 7 data, so that'll give us 6 data points to report on across the province. And with a substantial data set, I think our data set is now at around 260,000 children from 2004 to 2019. And one of the things that we're able to do with these data is highlight a couple of really important things, which is powerfully important for provincial people to understand. The first and most important is that we see we see still 1 in 3 children vulnerable in British Columbia. British Columbia still has one of the highest vulnerability rates across Canada. It's been high and it's been growing, and I'll show you some trend lines on that. The second really important thing that we highlight is this idea of an incredible diversity of vulnerability across both school districts and also neighborhoods. So you can see that range of vulnerability from 9% to 53% at the district level and 60% at the neighborhood level. And one of the things that Clyde always used to say, and we hold on to dearly, is that it doesn't have to be this way. If we know that we can get vulnerability down to 9% in some places, we can make a substantially greater effort to bring it down across the board. So this idea of holding this as a really important weather vane, if you like, or keystone in the conversations that we're having here. So you can see here in this province that the trend has been going up. This is my work on a substantive basis, is keeping this in front of our provincial government, and I think is underlying some of the more interesting policy directions that we see here at the moment. Interestingly, within that big trend on vulnerability, the vulnerability on 1 or more of the scales, we see some very different vulnerability rates scale by scale. So if we look at the EDI, which has 5 scales of development, one of those scales, and Marni referred to this, is the language and cognitive scale. And in British Columbia, over 15 years, we've seen a reduction in the vulnerability rate on the language and cognitive scale. And our assumption and our hypothesis is that that's something that actually as a society we have a fair degree of knowledge about how to intervene on. It's, you see early learning programs and approaches across many provinces, and our data would suggest that we've had some really good effect in that area. Worryingly, though, on our physical health and well-being scale, our social competence scale, and our emotional well-being scale, we see some really worrying consistent trends to the negative, so increasing vulnerability across those scales consistently over time. And this is something that I think really speaks to something that is a national trend at the moment, this idea that we're seeing this issue of mental health well-being as a consistently worrying trend, both for children, as our data give evidence to, but also youth and adults. And it really is helping us shine a light on the importance of us paying attention to this very early in life. As Mariette and Marni highlighted, the early years are a critical stage for intervention. So one of the things that we've done is, and there's all of our trends together. One of the things that we've done is use these data to do a couple of things. First of all, they've been really important in spawning a range of early years initiatives and interventions across the province. We've counted well over 1,000, and I would love to see more of Mariette's and Marni's work in our province around the effectiveness of some of these interventions. At the moment, we're pointing simply to the number. And we've also seen a growth in the number of what we're calling intersectoral early years collaborative tables across the province. And these are recognizing the fact that in their early years, children are touched by a range of ministries and professionals, and that we need to be working cross-sectorally to actually support the improvement in child outcomes as measured by the EDI and later in life. So I just want to highlight a couple of broad themes that for us have become really important. One of the highlight things that we're increasingly highlighting is the importance of shifting a lens from ill-being to well-being, from risk to resilience, and holding those two together. And the second is this idea of social emotional fitness, and that social emotional well-being starts in the very, very early years and the first years of life. So just a few things I'm going to skip through. This slide, one of the things that for us has been foundational as we've moved forward is the idea that to actually get effect and improvement in large-scale population-level outcomes, there are some things that we absolutely need to keep on doing. The first is strong intersectoral leadership. We need to see alignment, and these intersectoral coalitions are a good example of that, between health, school, early care, and learning sectors. The importance, and this from an equity lens, is absolutely essential, of improving access to programs and services. It's not always more investment. It's actually increasingly that the services that we have are more available to those who experience barriers, and continuing to do really good data gathering and research to ensure that what we're doing is effective. And this just simply highlights what for us is an important frame of reference when we think about how we're working with organizations, government, and communities across the province, that we need to be thinking at many levels. The interventions and programs and services that Marni and Mariette are talking about, but a lot of what they're talking about also intersects with large-scale policy that support children and families. And then this third piece that we paid a lot of attention to, which is community, systems, networks, and collaborative infrastructure. I'm just going to skip through here. I'm going to skip through here as well. So I want to talk just a little bit about engaging institutions and systems and communities towards, and children actually, increasingly. The involvement of children and youth in our work is increasingly important. And the idea that the data and research are not just simply important to a single organization, but it's about democratizing, I say, these data and research to as many people as possible, because there are so many people who can engage in supporting improved outcomes for children. And Marni talked about not engaging knowledge users early. I just want to really underscore and emphasize that point, that engaging them all the way through the process of what we do has been essentially important. I want to just say one other final thing before we finish, and I can see your little encouragements here, Diane, to wrap up. One of the things that I'm very passionate about at the moment is some work, early stage work that we've been doing that we're calling Growing Compassionate Systems Leadership. It's the idea that it's very important to have the best researched interventions and programs available to children and families. It's absolutely critical to build policy. But one of the things that we've become very interested in is the idea that we need to build leaders at every level of our systems to be able to work in deep collaboration with each other towards improving or transforming, I would say, the systems that we have away from this siloed approach that tends to be more service-driven towards placing children and families at the center. So we've been doing some early stage work in building a program around building compassionate systems leaders within collaborative groups and communities toward that end. I just want to refer you to our website. There's a ton of other resources there. You'll get the slides, so you'll have that URL. And with that, I will wrap up and say thank you to my co-presenters. I also want to acknowledge everyone at HELP. I'm speaking on behalf of them. There's a wonderful staff page on our website where you can go see all of them. I couldn't put them on a single slide, but it's a true team effort. Thanks so much.